Good afternoon, everybody, and thanks for joining us. I'm Julie Sanderson. I'm the event director for the Toledo Regional Chamber of Commerce. As we advance the effort to educate, motivate, and vaccinate the entire Northwest Ohio corridor to dramatically slow the spread of the COVID-19 virus, we will continue to provide the region's business community with the latest information regarding COVID-19 and the vaccine. This is our second round of the Vaccination Update for Business webinars in partnership with the Employers Association, the Chamber, the VProject, and the Toledo-Lucas County Health Department. One thing we know, things move quickly. We held a webinar on May 5th, and we believed today's webinar would be of similar content. And then last week, Governor DeWine announced an announcement about state health ordinances being dropped on June 2nd. Business leaders had plenty of questions. What does this mean for employees? Am I still bound by local regulations? And if so, what are they? Should I still enforce certain regulations within my business? So our panelists have quickly pivoted. Yes, there's that word again. We keep using that word. But they've pivoted their presentation today to discuss local and state regulations and how your plans might look going forward, and what you might be able to share with your employees in light of these new guidelines, as much as we know at this time. But we also know that advancing our effort to limit or eliminate health orders is because of the vaccine. So today we will also highlight vaccine points of dispensing, pods as they're known. Why are we focusing on pods in this session? I shared an analogy that I heard on a webinar with the Ohio Chamber and the governor's office that illustrates this. And at the risk of repeating myself, for those of you who joined us on May 5th, I'm going to share it again. It's baseball season, so it makes a little bit of sense. The Mud Hens are in full swing. But early on, our mass vaccination sites were critical to vaccinating many people quickly. So think of it like this: bases loaded, home run hit, many vaccinations with one at bat. But now to continue the effort, it's more like base hit after base hit. The endeavor will be in smaller measures, but as long as we keep hitting those base hits, we will continue to advance the runner and score, getting us closer and closer to that 70% goal that medical experts say will allow us to be safe, help our businesses and organizations thrive again without restrictions, something that's important to all of us. So a little baseball analogy for you. We have assembled a panel of expert speakers to provide an update on the governor's announcement, provide an orientation of operating a closed pod, share best practices and lessons learned of closed pods, and then provide guidance on legalities that we should be aware of. It's now my pleasure to introduce Terry Vanier, who is the Seminar Learning Manager at the Employers Association, who is going to introduce today's speakers.
Well, thank you, Julie, and good afternoon, everyone. Today we are pleased to have back with us for this week's panel, Brandon Polinsky and Greg Moore with the Toledo-Lucas County Health Department. Brandon has a Master's of Public Health, Veterinary Public Health from the Ohio State University and has been working in the public health field since September of 2013. Brandon serves as the Toledo-Lucas County Health Department's Planning and Quality Improvement Administrator, leading the efforts to maintain public health accreditation status and driving quality improvement, performance management, and strategic planning efforts. Greg is the Healthy Start Program Coordinator for the Toledo-Lucas County Health Department, responsible for the management, coordination, and evaluation of the Healthy Start Grant, contact tracing, pod volunteer, and open and closed pod orientations. He's worked at the health department for over 14 years. Greg earned his Bachelor of Science degree in healthcare supervision from the University of Toledo and his MBA in organizational leadership from the University of Findlay. Also with us today are Jim Yates and Sarah Palicki. Jim and Sarah are members of the law firm Eastman and Smith, where they build a practice servicing private and public employers of all sizes in nearly all industries in Ohio, Michigan, and beyond. Jim earned his Bachelor of Arts degree from the University of Dayton and his law degree from the Ohio State University College of Law. Sarah earned her Bachelor of Arts degree from Miami University of Ohio in Diplomacy and Foreign Affairs and her law degree from the University of Toledo College of Law. We also have with us today Kara Hart, Senior Manager of Benefits at the Andersons. Kara has more than 10 years of experience specifically in the benefits area and over 20 years of experience in human resources. She earned her bachelor's degree in human resources from the University of Toledo and has served with various HR organizations, including the Northwest Ohio Human Resource Association, Society for Human Resource Management, and the Ohio SHRM State Council. We're honored to have each of you with us this afternoon, and we thank you for taking time to share your expertise with us. At this time, Julie, I will turn it back to you.
Thank you, Terry. Before I turn it over to our panel, just a reminder to keep your microphone on mute to reduce the background noise. Also, please either put your questions in the chat box or make a note to share at the end. We will wait until the end to address the questions we have found that a lot of times the presenter is going to get to whatever your question is just a little bit further into their presentation. And then Bob Bethel will lead us during the Q&A and actually will get us through the sessions this afternoon. As I said at the beginning, we are recording it, and I will send you the link when it is available for you to share or review again. We also know that our speakers will attest to this, that this is a very fluid and moving subject. So what is being shared today, here's our timestamp, is accurate as of today, May 19th. So with that, I will turn it over to Brandon, who is actually going to get us started. Let me unshare my screen.
Got a phone call from Gary Hodiger. I don't know if they're still married or not.
There we go. Okay. Hi, Julie. Hi, everybody. Let me share my presentation real quick. Okay. And if you could confirm that you're seeing what you should be seeing.
We're seeing both your presenter slides and your note slides.
Oh. Okay. Well, let me. That's interesting. So, you know, there's always a new thing to, let's just do screen 2. Okay. Now you're seeing note slides or presenters?
Notes also. Yeah.
Both.
Okay. Well, I'm going to try it one more time, and if not, we're just going to go full steam ahead with it. Okay. Presentation?
Yep.
Cool. Okay. Well, hi, everybody. You would think that I have the controls all down by now, but I think like with every Zoom, we all forget we're on mute or the video is not working or your presentation behaves differently. So getting started today, our total cases as of today that we are reporting is 42,671 for the county. An amazing thing to see is it's less than 1,000 since our last update on 5/5. That is amazing. That's where we're trending. That's where we want to keep trending. I was so happy to see that number sub 1,000. Unfortunately, we do have 842 deaths in our community, but again, only 11 since our last update that have been reported to us. And some of those could have been historically older. The death data sometimes lags several months. Total tests in the community, we have 190,000 have been reported to us by the community partners that do report it directly to us. That's a lower number than the actual because not everyone is required by law to report to us. However, the state does require testing sites. They initiated that later last year to report to them. So that community positivity rate you see down there is actually from the state now based on a 2-week average in our community, and this specific rate came from data from April 28th to May 11th. So we are getting lower down there in the positivity, so that's amazing. I always say if you do have if you are ill, you do think you might need a COVID test, you had an exposure, please go to our web link and look at the testing sites that the partners who wanted to be listed with us are there, just to be safe rather than sorry. Okay, where we are, and it would also appear that my headings, and wow, a lot of the chart has completely disappeared. So I'm going to narrate for you based on memory. because it's there in the presentation. It just didn't want to make the journey to the full slide, I guess. We are down those last couple days outside the yellow are down into the 20s as far as cases per day. Those 3 yellow bars are the days most likely to change. Sometimes lab data lags. It takes a day or 2 to get to us. But we are trending down. Our average cases for the last 2 weeks is 47 and change. And that's down from 78 cases per day for the 2 weeks prior to that. So we are heading in the right direction. We're excited for that. It's really amusing what's going on with my presentation today. So that's very interesting. Okay, a slide that's working properly. Hooray. The variants of concern in Lucas County. We do still have these 4 variants. We have not been notified by the Ohio Department of Health of any additional variants of concern that they are looking at. This is what's in our community, and this is from passive surveillance. So chances are these numbers are actually higher, especially of the B117, because that's over 65% of cases nationally now estimated. It's pretty much the dominant strain now in the US. And we've had a few of the others. Oh, hey, there's the last little bit. So variants are reported through the passive surveillance process, as I said. Okay. So a little bit different from the past ones, we're going to jump into how some of the guidance has changed and what those changes will look like in the future moving forward as well. So this first section deals just with today through June 2nd. And what the guidance currently states, because the Ohio Department of Health and the governor did amend their current guidance, is that fully vaccinated individuals, as of right now, through the 2nd, no longer are required to wear a mask or to socially distance unless they're in very specific circumstances. That includes public transportation, visiting a congregate care facility, like a long-term care facility, a nursing home. So there are a few exceptions there, or where a local organization or business may require it. No shirt, no shoes, no mask, no service. That will become up to the individual business. I put in there local orders as well, because some municipalities may still have orders. For those of you with longer memories, I typically have COVID brain. My mind clears every 10 minutes now. But for those of you with longer memories, Toledo City actually put a mask ordinance in place late last year. And we've talked with the city officials to verify and make sure that also will expire on June 2nd. So that was only for the duration of the state of emergency. So for anyone who does remember that, you will not have to worry about that superseding the state orders being rescinded on the 2nd. For unvaccinated individuals, you must continue to follow social distancing and mask guidance already in place. There's no new rules regarding that, but basically through June 2nd, you are still required to mask anywhere that you're around non-household individuals, indoors, outdoors, the same. Using public transportation, that's the same for vaccinated individuals at this time. June 2nd and onward, every Ohioan will now have the option to wear mask or social distance. All of the public health orders, with a few exceptions, will be rescinded at that point. Some of those exceptions will still include public transportation. So if you're flying on a plane, if you're riding on a bus, you're still going to need to wear a mask. Again, where required by individual organizations. So individual organizations will be able to set their own mask or distancing procedures based on what they feel prudent for the individuals they serve. If you serve individuals that are primarily immunocompromised or any special niche like that, you may want to consider having a lot of these strategies still in place. But that will become up to the individual organization. As I stated, all other orders will be rescinded with another exception. So quarantine and isolation for disease. I know some individuals might say, well, hey, that's going to be taken away on June 2nd, but it isn't. And the reason it won't be is because that's still part of state law. It did not come about with the COVID pandemic. We have always had quarantine and isolation laws for various infectious diseases. So how that will look, if you're a vaccinated individual, you will not need to quarantine if exposed to a COVID positive individual if you have no symptoms. If you do develop symptoms after an exposure, then you will need to isolate from the date of that exposure for the 10 days. And that is because the vaccines have proven very effective at limiting transmission of COVID in vaccinated individuals or to vaccinated individuals, but it's not 100%. No vaccine is. So some individuals will still get COVID or one of the variants of COVID. However, it's typically a very reduced severity of illness and very much lower likelihood that you will be hospitalized or have severe complications. For those who are not vaccinated, you will still be quarantining normally. The gold standard guidance is 14 days. In Lucas County, we also allow the 10-day quarantine pathway with 4 days of symptom monitoring. So that is something to keep in mind. And again, we do let individual entities, the schools are able to choose if they want the 14 or the 10-day. Businesses, well, not so much businesses, it's more applies to schools and wider scale implementation, but we do allow that pathway, essentially. Okay, the rationale and the evidence for some of this guidance, because I know there's a lot of things in the news. COVID has definitely been politicized more than we would ever have wished for in our lifetimes. But some of the reason this guidance is changing is because of the vaccines, as I think Julie or maybe it was Bob that said earlier. The preliminary evidence does support that all 3 vaccines in the US have cross protection to the variants, especially the B117, which I said is now the dominant strain in the US. It's not as high of protection as the strain that the vaccine was originally made for, but across all of the studies that have been conducted, vaccination-acquired immunity has protected better against COVID and the strains than naturally acquired immunity. So for the individuals who say, well, I'll just get COVID, it's not that bad, and then I'll be immune, it's actually, you're still more at risk than someone who was vaccinated from one of those other strains, or even a possible reinfection of the original strain that you might have had. There's also a growing body of evidence that vaccinated individuals will not have asymptomatic infections, or they're asymptomatic. I mean, it's just much a lower likelihood. That's still being researched, but that is preliminarily what's coming out. And we've already, we being health individuals who've been immersed in this, have seen a lot of that evidence that you're less likely to transmit when you are after you are vaccinated. Still not 100%, as I said, no vaccine can protect everyone 100% of the time for any disease. So there still is that possibility, but it seems like the likelihood is much lower. And of course, another reason that they're looking to relax some of these steps is to try to increase vaccination uptake, and just that cooperation and adherence to the guidance that's happened this pandemic. That was a big sigh. That was a sigh of, we've gone through this for the past 14 months and we're so close to getting more back to normal and finally being done. So that was not planned. So that just happened. But one other thing that is in the new order is business signage. The state updated this to say that your signage should have something about unvaccinated individuals need to still wear a mask and social distance. If you have general signs that requires everyone to wear a mask or social distance, you wouldn't have to change those. And again, this is until June 2nd when those orders expire. Now, the state may put out a different order or different guidance that you still need some kind of signage, or at least to tell your clients if you require masks or not. I don't know if they will do that, but this is what exists in the current order that's set to expire on June 2nd. And they do have some posters and signs and assistance if you should want them to help you with that. Okay, for those of you who do want to still employ preventative measures after the 2nd, this is really where you might consider, or what you might consider doing. For individuals who are unvaccinated, still wear facial covering, still social distance. If you are vaccinated or unvaccinated, hand washing, you should have been doing that before, but especially do it now. If you're sick, stay home. So as I said, no vaccine, I've said it like 5 times now, no vaccine is 100%. Individuals who have been vaccinated with symptoms, there is that chance, especially if you had a known exposure, that it could be COVID. So you want to stay home, or you want to consider getting tested if you present with symptoms. If you're not sure, if you had a doctor diagnose, no, you have bronchitis, or we tested you and it's X, Y, or Z other than COVID, you wouldn't necessarily need to get a COVID test at that time. But talk with your medical professional if you're unsure, or if you just want to have that additional guidance. Again, always my plug, if one of our contact tracers calls you, please give them the information they want. That helps us contact your contacts, that helps us limit the spread and track what's going on at the community level. And those things do still stay in place per state law. So quarantine and isolation will not go away, even though the rest of the measures will. Okay, on to vaccination itself. Our stats for Lucas County, we are over 180,000 individuals vaccinated. For those who keep track of the information, we have 428,000 in the county. So we are over 42% of the way there. And that's of the whole population. Obviously, not everyone is eligible. Although if you are 12 and above, you are eligible now. So consider getting vaccinated. That is an increase of 8,600 from our last webinar update. As far as second doses are concerned, we've given almost 15,500 since our last update. And this is across all community partners, not just the health department, but the hospital systems and everyone else. So we are getting there. We'd like to get there a little faster, but we're in that stage where everyone who was vaccinated got vaccinated right away, and we're trying to drum up that support. Towards that end, for those of you who have not turned on a news channel or social media, the governor does have the Vax-A-Million lottery going at the moment. You have a limited time to register for that if you should so choose. I don't have the link in my slide, but it's, I think, ohiovaxamillion.com, or if you search in Google, you'll find it easy enough. But everyone does need to register individually. So if you are interested in that, we're hoping it's an incentive that will maybe drive up vaccination numbers. And everyone who's vaccinated, the better off we are. With that being said, if you do want to get vaccinated, we post a vaccine schedule of our walk-in clinics. You do not need to necessarily schedule, but you can through the link on the slide here. But we do post on our website, lucascountyhealth.com/COVID vaccine, a list of all the walk-in clinics that we're hosting around the community and the dates. We also have partnered with the VProject and TARDA, and we do have a TARDA bus that goes to various locations now to do vaccination. So we have a lot of options for anyone who might be interested. This just walks you through when you do that sign up, scroll down, enter the Maumee zip code. You probably don't even need to just limit it to Maumee. That was when we were doing mass vaccinations at the rec center. And the system had a radius limit of 20 miles. So we didn't want you to put a zip code too far away. Yeah, and select your location, et cetera. But as I said, we do have walk-ups that is acceptable. And that also brings me to the close of my presentation. Any questions, please feel free, or if you think of them later, that is fine too.
Thanks, Brandon. We do have some questions in the chat, but I think we're going to wait on those until we hear from the rest of our esteemed panel here. Greg, do you have something to add from the health department also?
Yes. Give me 1 second. Can you see my?
Yes.
All right.
Hey, how come yours worked?
All right. So I'm going to talk to you today in case you'd like to get a vaccination brought to your agency or your organization or business about closed pod planning. So what is a closed pod? So pod stands for point of dispensing. So depending on, the incident, it could be either an antibiotic, medication, or in this instance, a vaccine, where you would go out to either, like for the rec center, that's considered an open pod. So anyone in the public can come there, where a closed pod is more like your business, where it's only open to your customers. It could be family and other staff or even partners. So the benefits of being a closed pod is, depending on your safety plan or emergency plans that you have in place, you could add that to that part of your plan, so your employees know that you're also taking care of them in that and having that resource for them. And then also just showing your partnership with other agencies in the community, including the health department. The things that we ask if you would hold a closed pod is, basics. And even if you didn't have tables and chairs, just let us know and we could help bring those as well if needed. And then some of the positions, such as an IT aide. So we do need Wi-Fi. We need to, connect to the web to put a lot of this information in. A site liaison, somebody that's going to be that main point of contact that we can reach out to. And then depending on how many folks you would have at your pod, you might need security as well. And as I suggested before, pens, markers, highlighters, signage, a lot of this stuff we can bring too. If you don't have that in bulk, just let us know. And then essentially, for the most part, a closed pod, the health department's just going to come work with your site liaison. We're going to bring those personnel, the nurses, the vaccine, all the supplies that would be needed. The coolers, people ask about refrigerators and freezers. We would bring whatever's needed to take care of that site, and then personnel as well. And then obviously, if you have additional folks that would volunteer, that would be up to you. And then it would just be up to you to kind of communicate that message out to your employees, clients, or family that would be willing to come to that pod. So some of the legal concerns, I know a lot of businesses always want to know, okay, liability. So there are different preparedness acts and language out there. So I'm just listing this, for your information. We also have, our prosecutor too. If you have specific questions, you feel free to email myself or Brandon, and we can get those questions answered for you as well. And then if you're interested, it's actually pretty easy. Just go to lucascountyhealth.com/COVID vaccine. You'll see business/organization vaccine clinic interest sign up. Click on that link, put your information in. And then typically within 2 weeks, somebody will reach out to you to see what day would work best for you and your employees, and then just kind of walk you through that process again. And that's pretty much it in a nutshell. It's pretty easy. I was recently told, just kind of an update from the last meeting we had too, if there's any interest in having the TARTA bus show up at your work as well, I guess that is also a possible option. Just let us know when we go up and try to get you something together. And that's all I have.
All right, very good. Thank you, Greg. And Kara, you want to share with us a little bit about your experience holding a closed pod at the Andersons?
Sure. I think Greg is still sharing.
Greg, you want to stop sharing your screen there? There you go.
Okay, let me try to get this up here. Is that working?
Oh, yep, perfect.
Okay. Let me try to switch pages here. Okay, is that working? Okay, so the Andersons has implemented strict COVID protocols over the past year and a half. Most employees here in Maumee at our corporate office and at some of the plants and other locations have been working from home since the orders went in last March. Some of the plants have essential workers who have been working the whole time. So we have been trying to make sure that all the protocols are in place because we are slated to bring everybody back to the Maumee office and other locations on June 14th. And our Maumee corporate office is the largest group of employees who will be returning. And we wanted to ensure everyone had the opportunity to obtain a vaccine if they wanted one, especially at the beginning when appointments were very hard to come by. We wanted to, without mandating vaccines, try to get the message out to everybody that vaccines were going to be available. So why we were doing the clinic, but also our CEO has done a lot of videos getting vaccines themselves, just showing that it was okay to get the vaccine. We have some newsletters that go out to the groups every week. So just promoting getting the vaccine as people start to travel to locations promoting that. And then we've also helped out some of the other locations that are smaller in nature to try and get some groups together to get them as well. So there's been a lot of communication surrounding the vaccines and why people should get them. So we partnered with Rite Aid to offer vaccine clinics to the Andersons employees at our corporate office based on whichever vaccine guidelines were in place at the time of the clinic. So our first clinic we held on March 25th and had the second shot of Pfizer on the 15th. At that time, we had 154 people and included employees from 6 of our Lucas County work sites. That clinic we did employee only because we wanted to try and get as many employees vaccinated as possible. We originally started with a 2-hour time slot and ended up with a 3-hour time slot. Rite Aid sent 2 pharmacists for those appointments, and we were getting about 50 plus an hour to be able to be scheduled. Our second clinic we held on April 15th, which was the second shot day as well for the first group. And then they came back on the 6th and we had 53 people there. We had opened it up for spouses and children at the time. It was 16 plus. So we opened it up then, and I'll talk about in lessons learned why that number was not as big in a minute, but so we had less people. But so we notified employees of the vaccine clinic and the registration process. Once people were registering and we kept the schedule, we sent them out the logistic information, we sent them out the vaccine information, the screening form to complete, any on-site COVID protocols that we were going to have, and then confirmation of their time. And then, as I said, 2 pharmacists were coming. We set up 5-man stations to ensure that all of the protocols were met. We had a mask and temperature check at the building entrance to make sure everybody was properly using those items. We had a station that was sort of a welcome station to either check off that they were here for an appointment or to make sure that they had their form completed. If not, we then had another segregated area where people could go and fill out the forms that they forgot to, bring it with them, and sanitized all the pens and all the materials that they were using. We had a station which was a social distancing line check. So as people came for their appointments, if they were backed up a little bit, we made sure they were separated. And then we also had a waiting area for after the shot was given for the check to make sure that there were no reactions. We set that up socially distanced as well. And we had multiple timers so that people could have a timer. We would sanitize afterwards so that we could keep cycling through the 15 minutes. And then we had a final station where we gave them an appointment card to check out so that they, as a reminder to come back. We also emailed them later on to remind them of their second appointment, but just gave them that so we could get people, we just kept people in and out as much as we could. The Rite Aid pharmacists and their pharmacy leader arrived an hour early for setup. And then we had our little group of volunteers who continually sanitized chairs, timers, tables as we were cycling people through. And we got for the first clinic, the 154 people through. And at the second clinic, we were simultaneously doing the first shot and the second shot as we were cycling through, as well as people came early. Rite Aid completed the final review and proceeded to vaccine. And then, as I said, we had people wait the 15 minutes and then get their appointment card to follow up 21 days out. This is just, and I'm giving credit to a member of my benefits team, Audrey, who put together the layout. She's much better at this than I am, but this was kind of how we cycled everybody through. And so no one ever really came into contact with anybody as they cycled through. So you have to have a big enough area to be able to do that and keep everybody socially distanced. So we were able to we had our welcome station and then cycled everybody through the lines to where they had the shot, and then they had the waiting area, and then they just walked right out and were on their way. So we had people in and out of there probably, I would say within 20, 25 minutes, 15 of those being their waiting time for the shot afterwards. So lesson learned. When we originally started doing this, we had a scheduling system that people could sign up, and we did 8 slots per every 10 minutes to try to get as many people. And people were less likely to sign up that way because it wasn't as private. A lot of the privacy notices came out afterwards. So we immediately took that down and did the old-fashioned send us an email to the benefits department and we'll get you on the schedule and we'll figure something out later type of thing. But so they were more inclined to sign up, and we had a lot better response once it was a private scheduling. Social distancing became a little bit of an issue as people started to come in, or especially during the second shots where people didn't want to follow time schedules. They just wanted to come in. So trying to make sure they were social distanced in the waiting area. Reminders to bring completed forms were definitely necessary. People forgot to bring IDs and things like that. One thing I didn't put on here, another lesson learned, was to make sure to remind people to wear appropriate clothes, that you have to either be able to pull up your sleeve or wear layers so you can get to your arm to give a shot. We quickly had to find socially distanced private areas to figure out how to get people able to get the shot. So that was another, I should have put that up here too. Individuals pay attention to what's going on in the news. And this is where our second clinic, we announced that we were having the second clinic, opened up registration, and the whole Johnson & Johnson issue was announced. Now, our shot was Pfizer. It had nothing to do with Johnson & Johnson, but we were slated to have not as big of a second clinic, but we were slated to probably have at least 30 to 40 more people come. And they backed out because of all of what was going on in the news with the Johnson & Johnson. So there was a lot of hesitation. So you really want to pay attention to what's going on in the news. I'm sure in light of the orders being released and normalcy coming, I'm sure people are, watching that as well. And then having hard copies of the documents, we had provided ahead of time the description of the vaccine, what to expect, things like that. We needed hard copies at the time because people were asking questions after they got the shot. They didn't pay attention to what we sent out ahead of time, but we had it there and they were able to get the information that they were seeking while on site. So that has been our experience. So we got over 200 of our employees vaccinated. I don't know, we're not asking, so I don't know how many of those are not vaccinated or had gone elsewhere. And we are just, as an employer right now, sort of still following all of the protocols that are in place, even though some of the mandates have come out, because we're sort of waiting for OSHA to put out their regulations that we've been waiting on for a while to make sure that whatever we decide to do and lift is in compliance with that as well. So we're kind of along those lines. So with that, I think that is all I have.
Thank you, Kara. Interesting time that you had there. So,
Yes.
so we'll turn it over to Jim and Sarah next to tell us what's going on from a legal standpoint.
Well, I'll just talk a little bit about and follow up with what Kara talked about, which was OSHA and what's going on there. The short answer is we don't know, but they were supposed to issue an emergency temporary standard on March 15th. And we've heard that that standard has been at least drafted and is now sort of going up the food chain within the administration. And they've been having a few meetings with various stakeholders, but we haven't heard anything about a time frame for when or if now a new standard, new OSHA standard specific to COVID is going to be issued. And as far as tying that into the masking, I think that's important because the president came out in an executive order in January, and then OSHA followed that up at the end of January with guidance clearly saying that, masks were going to be required. So in light of that, at least that part of this standard is going to change, and maybe we don't. Maybe people, the powers that be, will determine that we really don't need that specific COVID standard anymore. Employers, I think, are hopeful that that's the case. So, and OSHA did recently come out. I think they were surprised, as were a lot of other entities, including businesses, including us, when the CDC came out last Thursday and indicated that fully vaccinated individuals did not have to social distance or wear masks. And as Brandon indicated, the governor came out pretty quickly afterwards, thank goodness, and said, okay, we're going to follow that CDC guidance, and we're going to issue an amended order to make sure that there's no confusion in Ohio, that we should be following this Ohio order or the CDC recent guidance, and made the two consistent. And so OSHA just came out and said the same thing this week, and said that that OSHA is referring people to the CDC guidance regarding fully vaccinated individuals, which would include masking, and actually had a link to the CDC guidance on their website. So at least for now, OSHA is saying that their advice is consistent with the CDC, which is what Ohio's done, which is great. So that's sort of where we are. We're sort of waiting to see if the other shoe is going to drop as far as an actual OSHA emergency temporary COVID standard is going to be issued. So, the one question that, Brian Dicken and Sarah and I were talking about before this meeting today is Brandon referenced the Toledo ordinance, and, Toledo, Dayton, Columbus, Cincinnati, all the major Ohio cities and a lot of smaller Ohio cities have had mask ordinances for quite a while now. So since the Lucas County Department of Health, I'll put Brandon on the spot, since the Lucas County Department of Health actually enforces the Toledo mask mandate, I guess I'd like to know if the Lucas County Department of Health is saying that really they're going to take the position that the CDC takes right now, that fully vaccinated people don't have to wear masks. In other words, if businesses within the city of Toledo have told their employees, if you're fully vaccinated, according to the CDC, you don't have to wear masks or social distance, is that okay under the Toledo, the Toledo ordinance? And is Lucas County going to come after businesses or individuals that are fully vaccinated between now and June 2nd? So that's all I have. I'll turn it over to Sarah, but I think that's probably a good question for Brandon that a lot of businesses are trying to grapple with.
So I'll jump on that real quick, if I may. The health department right now has no plans to issue any new local orders after the Toledo ordinance expires. We're not looking to institute anything at this time. And I imagine that unless the circumstances with COVID became very dire again, we would not do that. So in terms of your question of whether we support or we will be following the CDC guidance and the governor's order, yes.
Yeah, so that's great news. It's just going to take a little while for some of the municipalities and even other states to sort of get up to speed with what the CDC is doing. Ohio was pretty quick about it. Michigan was pretty quick about it. So that's great news. So the other questions involve sort of vaccines in the workplace and questions that we can ask or not ask of employees about that. So I'm going to turn that over to Sarah now.
Thanks, Jim. Yeah, we have received a lot of questions in the last few days about masks, and then over the last few months about vaccines. And really, they center on privacy issues and employee privacy concerns. And Kara mentioned the sign-up sheet for the closed pod, and employees really being leery to have their name out there on a sign-up sheet, you know, indicating that they are going to get vaccinated. So, you know, I commend Kara for recognizing that, and then, you know, giving people an alternative way to go ahead and sign up for the vaccine. You know, in an ideal world, and I'm sure Brandon would agree with this, we would be, you know, all wearing big posters, I'm vaccinated, you should get vaccinated too. And we certainly do have a lot of people who are advocates for getting vaccinated, but there are a lot of people that take this very seriously and want to make sure that they're handling their own personal health privately, and we can respect that. But that leads to the next question of, as an employer, how do you handle that? And so the first question that we've been getting with regard to the CDC guidance, and now Governor DeWine saying you do not have to wear a mask if you are fully vaccinated. The question that we got automatically was, how do we find out whether or not our employees are vaccinated? And can we even ask that question? And the answer is yes, you may ask your employees whether or not they are vaccinated. The EEOC has said that asking someone whether or not they're vaccinated is not a medical question. And the EEOC has also said that you can request proof of that, and that is not requesting medical information. However, there's always a but when you're dealing with employee medical concerns. If you ask an employee whether or not they are vaccinated, if you ask the follow-up question of why aren't you vaccinated, if the person responds, no, I am not vaccinated, that follow-up question might elicit medical information because of the individual's disability. So you should not be asking your employees, if they are not vaccinated, why they are not vaccinated. And we're talking now when it's voluntary in your workplace to be vaccinated. So assuming that it is not mandatory in your workplace to have a vaccine, do not ask the follow-up question of why are you not vaccinated, because that could elicit medical information that could run afoul of the ADA. The same goes with masks. And we've seen a lot of that over the last few days with this issue of masks. And when somebody comes in and businesses like Costco and Walmart announce they're going to the honor system, they're not going to stand at the door. The Costco greeter isn't going to stand there and ask you for your vaccine card. They're going on an honor system. So in the workplace as well, you can go on the honor system and trust your employees to tell you the truth. Now, if you want to ask and have your employees perhaps certify that they have been vaccinated, that would be acceptable as well. And as I mentioned, it is perfectly acceptable to go ahead and ask for proof of that. You don't have to, you can go on the honor system, but perhaps you should, you know, have a little form that the employees fill out that says, you know, I am fully vaccinated, and maybe you can even get the date of the second dose or the only dose in the case of Johnson & Johnson. That way it's more than, you have to make sure it's more than 14 days after the second dose, and then that person is fully vaccinated. You can collect that information from your employees, and if they tell you that HIPAA prevents you from doing that, you can respond politely to them that that is incorrect. That in most instances, HIPAA does not cover that question, particularly in the employment setting. And it is perfectly legal for an employer to ask the vaccine status of an employee. So we get a lot of questions about that lately. And certainly the confusion over the last week or so about wearing masks has doubled that confusion, because now we all want to know whether or not somebody is vaccinated, you know, because if you have an unvaccinated person that perhaps you're meeting with, you know, the vaccinated person doesn't have to wear the mask, or maintains social distancing, but the unvaccinated person does. And so you need to know that information when you're dealing with someone. So it'll be a confusing time for the next couple of weeks, but at least in Ohio, as Brandon explained, as of June 2nd, even unvaccinated individuals will no longer be required to wear a mask.
You know, one of the other issues that I think having an expert here from the health department would probably be a good time to get into is this health assessment. I don't know if Sarah, if you were going to get into that, and a lot of employers have these elaborate, temperature checking mechanisms set up, and my advice and our advice would be, don't get rid of all of the thermometers and your temperature checking devices just yet. Health assessments are clearly in the current order and always have been in the orders, but the current Ohio Department of Health order clearly talks about symptom checking, health assessments. OSHA's guidance at the end of January talked about it. There's OSHA emergency temporary standard out there. Certainly that will cover that. So a lot of employers that we're talking to are discussing maybe switching to having the employees doing their own health assessments, not having the employer get involved and actually temperature checking at the gate and that kind of stuff. So I guess I'd like to turn that over to Brandon for a comment, as I know a lot of our employers are interested in that issue.
Yes, so I'm looking to pull up the exact wording, but essentially symptom assessments, and they can be self-assessments, as you said, and they could have always been those, should be occurring for employees in the workplace, at least up until June 2nd. We don't know if that's still going to be orders have lifted except if you're symptomatic, or you should be still checking this, or what the exact guidance will be. As a best practice, I'm looking at my little screen instead of my camera, sorry. As a best practice, we would probably still recommend that you keep at least those symptom monitoring processes in place. Temperature checking is up to you. Temperature was never a perfect metric anyways, because not everyone who had COVID developed a fever, or their fever may have been short-lived or only lasted a short period of time. So I would say that falls more up to you. If it's very cumbersome taking temperatures, you may consider that you don't want to pursue that any longer, but you should definitely have some mechanism in place. We would recommend, I should say, you shouldn't, but I'm not saying you should have it, but we would recommend still keeping that that symptom monitoring aspect in place. And whether it's just, hey, are you feeling ill today? No, I'm not. Okay, thank you. Or it's more elaborate, would be up to you based on what your resources allow or what you really want to get into. And as long as the legal here says that you're not violating any medical information by doing so as well.
Sarah, I think you were going to answer a couple questions, and then I sort of cut you off. So I'm going to mute. Turn it back to you.
Well, the only thing I was going to say, I guess, in follow up to what Brandon said is, even before COVID-19, we in human resources continually tried to communicate with our employees not to come to work when they're sick. And now I hope anyway, that people understand that we mean it when we say it. Please don't come to work when you're sick. Stay home. Work from home, do what we can to keep the community from getting sick. And that includes all of your coworkers and things. So again, encouraging your employees to monitor their own health and stay home if they are not feeling well, and continue to have those signs up, those reminders. Please don't come to work when you're sick. It's just really important to do that, and doing your daily assessments. The other question that just popped up in the chat that I received was, how do you ensure someone who is not wearing a mask indeed is really fully vaccinated? what are businesses doing to ensure compliance? Are we using the honor system? Are we requiring a vaccination card? Really, it's up. The answer to that is it's up to your business and your culture. There are a lot of businesses where I can see it would be perfectly acceptable to be on the honor system, where you ask your employees perhaps to, like I said, fill out a form that says, yes, I'm fully vaccinated, and not require further proof than that. If you have an employee that is lying to you about their vaccination status, that's an independent reason to take disciplinary action against the employee. We ask our employees to be honest with us about various things throughout their career with us. And this is just one more thing. If your workplace culture is more compliance oriented or very paperwork oriented, or you really want to have that assurance, the EEOC has said it is okay and not a medical inquiry to request a copy or proof of the vaccination. So, have them show you the card, take a copy of it. If you take a copy of it, I would suggest it doesn't contain any medical information, but I would put it in the medical information file as opposed to the employee's personnel file. It's just something that is teetering on the private medical information area that I wouldn't want it, next to the employee's evaluation for the year, things like that. So you'd want to keep that in a separate file, but that is lawful too. So if you want to ask for proof from your employees, that's okay. If you want to go on the honor system, that's okay too. It just depends on your workplace culture and how you operate.
So how we always say that the information is current as of like right now on this. So
What changed?
So Brian, so the mayor of Toledo must have been listening to us, and so Brian Dicken from the chamber has forwarded the press release that just came out from the city of Toledo that said that's basically answers the question, and maybe Brandon shot him a quick text or something. From today until June 2nd, residents who are fully vaccinated are no longer required to wear a mask unless they are specifically designated areas like airplanes, buses, healthcare offices, or in businesses or municipalities that require a mask to be worn. But this is from the city of Toledo. So I'm assuming that now the city of Toledo is saying that, and then after June 2nd, mask wearing is going to become voluntary. So I'm assuming, since the mayor just issued this, that the city of Toledo is adopting the CDC guidelines as of now, and that answers that question that a lot of our employers had. So thank you, Brian. And now you're current as of 2:58 today. And things may change in the next hour.
Yeah. Just think how influential you really are there, Jim. I'm pretty impressed that you got that question answered from the mayor that quickly. So there are a couple of questions that came up in the chat here also. And we may have somewhat answered these, but from Lori Nowak, are there restrictions in asking employees if they are vaccinated during the contact tracing process? So I think that's been answered, that really there's no restrictions on asking about people are vaccinated at any time. Then
that's right, Bob. And I had that question back when they first came out and said you don't have to quarantine if you've been vaccinated. How do you find that out? So I was suggesting, well, when you're doing your contact tracing inside the office, if you have somebody who's COVID positive, you ask the people that were in close contact with that person, have you been vaccinated? Are you fully vaccinated? And you have that answer. So yes, that is permissible.
Yep.
And to follow up with that second question too, that is correct. A fully vaccinated person does not need to quarantine if exposed to a COVID positive individual unless they have symptoms. If you develop symptoms, then you need to isolate. But if you remain asymptomatic or you don't have severe asthma and you're 90% sure your coughing is related to a pollen attack or something, which confirm with your medical professional, but even so, asymptomatic exposures do not have to quarantine if you are fully vaccinated. We've had a couple heartbreaking cases where the person's like 10 days past their second shot and we still had to quarantine them, but yeah.
Okay. I have one last question. We're right at 3 o'clock, but we'll throw this out to Jim and Sarah there. There's been some talk about this whole Vaccimillion thing, whether it's really legal use of government funds there. So any opinions or thoughts on that from you two? Because it looks like it's effective. That's what I was hearing last night. The day after it was announced, there were, there's the highest day of vaccinations in 3 weeks or something. So are we going to get the rug pulled out from under us after we get a whole bunch of people vaccinated? What do you think, Sarah?
Jim asked me that question this morning. I have no independent information on whether or not that's legal. My response was, I assume the governor and his staff did their own legal research and got an opinion on that before they decided. But I'm sure there are lots of law firms out there that be willing to look into that and represent either side.
Yeah. All right. Thank you very much. With that, I think that's all of our questions. Julie, I don't know if you had anything to say to wrap up, but thanks everybody for participating, for joining us for this. Great information again. Brandon, I see you have your hand raised there. What's up?
Yes, I'll add one more thing. If you ask an employee for their vaccine card and they say, oh, I lost it or it went through the wash, you can request a new vaccine card from the health department. Just call our main number, 419-213-4100, and then option 1 will get you to our call center for COVID related questions. So we can help you with that verification if the document was destroyed. I laminated mine personally because I knew I was likely to destroy it. After the second dose though, don't laminate it after the first, unless you got J&J. But yeah, so I just wanted to let them know that resource exists.
Great. Thank you.
I just wanted to add, thank you everybody for attending. Thank you to our panelists. I always learn something new. I see a lot of things coming up in the chat. Thanking you for sharing your afternoon as well. We did record this session. Give us about 24 to 36 hours to get it downloaded, formatted, and then I will send everybody the link. So have a good afternoon, everybody. Thank you very much.
Thanks, everybody.